Well, yeah, Jeff Salo, chiropractor. My office is, you can hit a golf ball about 500 yards that way. You hit my office, so I'm pretty close by here. This makes it pretty convenient to come and talk to everybody and be here. This is a great group. And the guests, I've been here, I don't know how many, a couple of years, 2, 3, 4 years, but as being the leader of the group, we do a lot of business, a lot of good people here, a few exceptions. But they're not here today, so we're going to be talking about that. Because physical, mental, and chemical is how you're made up of balancing your health. There's those components, this is like a car. You can't have one that's really good and one that's really bad. They need to be balanced as much as possible. And that's pretty difficult to do because we take advantage or disadvantage of our bodies and take them for granted, and then all of a sudden they break and we don't know why. And there's a component we've got to find out what's breaking you down. Your body's run from the blood down inside out, through the brain, down the spine, comes out. And then you put outside in is man-made, and it's not, it works for you, but it's not the best for you. The more natural you can be, the better off you. If you're on a prescription drug and you need it, fine. But you need to know why you're taking it, how long you're taking it for. Okay? That's how we're talking today. I'm going to talk about physical. These are the components that come up with your physical component. The mental is how your emotions work, how you are, and social, which is supposed to be chemical, is how you eat. So between your diet, your exercise, what you do in life on a daily basis makes a huge difference on how your body is healthy or not. Because if you don't do this properly, you're in a health of disease, not going forward. Next slide. Oh boy. Yeah, what time? People have to leave at 9. Okay. Not sure for all this, but people think chiropractors work with the neck and the back only. We work with a lot. We work with the whole body. If you have a joint in your body, no JT, not that joint. If you have a joint where two bones meet together somewhere in your body, we can adjust that. But there's all kinds of other symptoms that come across that what we can treat. Neck pain, headaches, shoulder, frozen shoulder, cuff pain, wrist, carpal tunnel, back pain, all that, you can read it. There's so many different things that people come in for. And the funny thing about it is they'll come in the office and they'll go, I got this blah, 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 and I don't know why. I'll go, well, first of all, you haven't been 60 years old before, so now you're starting to feel what you've done in the past. And let's go attack, see what's going on in that area, and find out what you're doing, why it's breaking down, or if we can't correct it, then we're going to try to maintain it. What makes me different from most chiropractors is I work with corrective care doctors in the very beginning of my internship, and we did corrective work, where we didn't take people basically for pain, we took them for a problem we had, and we put them under a couple weeks and months of a process, and try to fix their problem. After the market crashed in 2000, whatever that was, 7 or 8, 9, John, yeah, the people didn't have any money anymore, so they stopped buying these. Packages, and we have started going to treating people as they can come in. So I do corrective work, but we treat pain. Most people come into the office for pain in the beginning. They get out of pain and they realize what their body feels like and how they feel, and they want to make a difference. So we're like, there's something about this. I don't know really what you do. I know you jump around on me. We don't crack anything, we adjust. That cracking is that popping noises, but people start to develop a sense of how they feel better after they start getting adjusted. It's no different than probably having your teeth cleaned, taking care of your mouth. Same principle. We don't see our spine, so we abuse it until something goes wrong. Okay, so we treat a lot of different things. You want to ask about anything about that later? You can ask that. Next slide, please. Thank Sean, first of all, because not only is he our membership and the website, he's our AD guy, IT, he does everything. So if it wasn't for him, I wouldn't even be able to thank you, Sean. Okay, where are we? Okay, posture. Kathy was asking me about that, and this is probably one of the most important things. Look around. Look around. Oh my gosh. All these beautiful faces. Posture is really super important. Your parents told you this from the very beginning. Your structure determines your function. So it's just like anything else. If your structure is not balanced, and proper, your function is still going to work, but it's going to work at less efficiency than it's supposed to. No different than your car. Okay? You can let your car go. It could be 20 pounds of pressure on the left side and 40 pounds of pressure on the tires on the right. Your car's still going to go down the road, but eventually something's going to happen to the car. Okay? Your daily activity living is super important of what you do and how you do it, how you're sitting, how you're sleeping, how you're standing, how you're working at the desk. All of that comes into play. We get fatigued, and so what happens is we start doing all these different little things like everyone's doing right now. That's okay. You just need to be aware of how to change that pattern instead of staying in that pattern. Meaning, oh yeah, okay, I never sit straight. Once you start having better posture, your muscle memory starts to take over, and it's easier to sit up straight than slouching all the time. Okay? So your daily activity living with all things come into play of how your body is affected through how it works. Sitting, sleeping, driving, like I just said. Driving is really bad because people get into a really bad pattern in the car with the console, the door, and a lot of issues where people come in and this guy says, I just got out in Colorado, I have my hand out the door all the time. I'm like, wow, that's pretty amazing from Colorado. But your positioning is super, super important. Motor vehicle accidents goes without saying. People don't realize, even though you're not bleeding, you don't have a broken bone, you feel okay, you get up, you're like, oh, okay, I'm all right. Your car's all smashed up. You're okay? You're not okay. You need to get checked out. Internally, your body's been stressed with trauma. Okay? So motor vehicle accidents play a big role in bodies and how they respond, because I'll have someone come in and go, yeah, I'm doing a motor vehicle accident. Yeah, I was in a motor vehicle accident a couple months ago and I can't do the blah, blah, blah anymore. Well, something happened there and he didn't get it fixed, and now if there's a problem, you have to fix that. It's really important that you get checked out if you've been in a motor vehicle accident before. Slips and falls, huge at this point in my senior patients. It's not because they're clumsy, it's because the dexterity changes in your body as you get older. And simple things as tripping over a seam on the sidewalk or a bump somewhere comes into big play. Now you've got other issues when they fall down: hip, back, knee, wrist. Childhood injuries come into play later. That's when people say, oh, they start taking their history. That's why I take a history when they come in, because I want to find out your history needs to be probably 80-90% of your story. They'll come back next visit and I'll do reported findings, and they'll come back, oh, I forgot to tell you, I did that when I was 6 or 7. So those come into play why you have the symptom that you have and why you're complaining about what you're complaining about. So it's very important to take that down. Repetitive overuse injuries, we all probably do that. That's more well, it's in all kinds of fields, but right now, desk work, a lot of stuff there. And the up and coming thing is the text net, because we're all doing this now. So that's why that posture becomes an important play. These are just some diagrams. This guy's got a forward head carry. Most of us have that. Okay, we do this. Our neck is supposed to be in a 45-degree angle, where this earring, if I had one in my ear, would touch the top. It was in ZZ Top, I had one before running. But the earring, the pin should touch the top of the shoulder. Okay, but we all do this. If I measure everybody right now, we'd all be having a forward head carry. That puts pressure on the cervical spine, which is very important where the brainstem is. That chokes the signal to your body. This is a good posture. I'll see what it should be. No one does that because it's hard to do that all the time. You have to train yourself to do that. This is what you were talking about, Captain Ray. Forehead care, sway back, round shoulders. What happens? She asked me, why do you get this little hump right here? Okay? Remember, the neck is supposed to be in this position. It's a C-shaped curve. This guy didn't pay his bill. So, yeah, one way or another. It's supposed to be like this, okay? So, this is this skull right here. This is where the shape of the spine is. When we do the forward head carriage, what happens to the neck is it does this, okay? These transit processes start to pop out. This is what you're feeling, that hump. This is the hump right here. Because the head's coming forward, forcing a different angle of the spine. So that's why, your shoulders back, head up, chin in, chest out. But that's where the hump comes. So it's called a Dyer's hump. I think that's the doctor who probably invented it or discovered it or labeled it years ago. Okay. So posture comes into a huge play of how your body responds. And all I'm trying to get across today with the posture lecture is be aware. Know what you're doing, change the position. Prolonged sitting is bad. If you're at a desk all the time, you should get up about every 20 minutes. Just even, they used to say in the old days, go smoke a cigarette. Now they say go to the water cooler and get a glass of water. But just to change the positioning that you're in. Okay, so posture, think about it. What are you doing with it? And how are you doing with it? And is it helping you? Any questions before I go to the next slide? And I'm bored all you guys have because they're asleep over this.
I want to make a comment based on what Jeff told me. I got a little app on my computer that basically pops up every half an hour, and it makes my computer unusable for 4 minutes. And so that gives me a chance to get up and go do something, because the rule of thumb was 3 minutes of exercise for every 30 minutes of sitting. So I get up from the computer.
That's smart, actually.
Yeah, and it was a free app that I found, but it was his suggestion that got me doing that. And so now I get up and I have weights, or I do yoga, and then come back, and hopefully the timer's done. I can get back on the computer.
You get involved in a project and you're on a computer for hours and don't even realize it, and then when you start your body starts to fatigue. The next thing you know, you're like this. You're all I used to have a mirror next to my computer at home, and after a while I look in the mirror and go, ah! You're just like, it's terrible. So just change the positioning is super, super important to your body. And it's an old saying, if you don't use it, you're going to lose it. Okay, so movement, remember Jim? Okay, so it's super, super important that your movement throughout the rest of our lives is super important. More people that get sedentary and lay on the couch and watch Jeopardy all day are going to not function as well as the people who are at least getting up and moving and walking and trying to do something. Okay, so next slide. I just want to show you some final things. Those are probably going to be the best about the best thing corporations to start buying out for companies, because they're realizing that sitting down, they start to get work comp injuries because people go out, they have back problems, so now they're using these desks that are becoming more and more popular every day. So, anyway, this is where I was in La Paz a couple months ago. The picture on the right is Hurricane Olaf, which we didn't know. So get up in the morning, get up about 6:30. I goes, gotta get out of this little storm out there. Get out there, we're fishing, we're catching fish, and we're having a great time. We're looking at this thing kind of rolling in. We're going, wow, look at the shape of that cloud. I'm like, well, man, that's pretty cool. So we're all taking pictures of it. So about half hour later, the captain goes, reel in, we gotta go. And you hear him on the walkie-talkie, he's like, and long story short, we're watching this thing fall. We do an hour and a half out. And 45 minutes of tides, and we got poured on for 45 minutes. And we get to the hotel dock, and everyone's out there and scrambling, the stuff. And we're like, what's going on? Like, it's a hurricane. Like, you guys knew this already. So it was we lost power for 24 hours, no heat, no water, no electricity. It was a great time.
But you caught your fish.
This is my first fish.
What is that?
Oh, that's a Dorado.
I thought it was a Dorado.
Dorado, mahi.
Wow, yeah.
Right? So what would happen
Very nice.
is we came through. This is our captain. You can tell he eats pretty well.
And he doesn't eat just fish.
I know exactly. I had tacos.
Beer too.
But they would bring we'd come to the dock, we stay right there. They would fillet the fish right on the dock and hand it to the chef. It was,
nice.
I got to order anything I wanted that night for dinner. And we felt like kings. You're in the middle of nowhere. It's a fishing village. There's nothing else there. Nothing. So, but that was a good time. This was a great experience. And I'm going to thank you all for your time today.